Deputy President, Honorable Rigathi Gachagua, my colleague Cabinet Secretary is present, Excellency Governors present, Senators, members of the National Assembly, senior government officials present, and all the people of Tharaka Nithi. Good afternoon. Thank you very much, Your Excellency Deputy President, for always ensuring that the Ministry of Health is part of this conversation. And we are happy, and I passionately endeavor to attend all of them, because these aligns with our thinking at the Ministry of focusing on preventive and promotive health and not just curative. So these conversations that we are having here is one way of preventing the effects and the impact of drug and alcohol abuse on health. Your Excellency, besides the direct impact of liver disease, lung disease, and cancer associated with the drug and alcohol abuse, we have other impacts that end up being health issues. Your Excellency, people who are involved in drug and alcohol abuse, in most cases, they end up with mental illnesses. And as a ministry, that has become one of our key concerns. Next to that, Your Excellency, these people end up with impaired judgment. And due to impaired judgment, they get involved in many activities that impact health negatively at the end of the day. Many of these people, Your Excellency, are the ones that you will find are involved in gender-based violence. These people end up either in hospital or somewhere else affecting healthcare. Your Excellency, the drug and alcohol abuse are the same people who will end up impregnating teenage girls. This impacts healthcare. Due to impaired judgment, Your Excellency, these are the people who will get involved in accidents, they injure themselves, end up in hospital. And if they are driving, they'll end up causing accidents on our roads, and these people will end up in hospital. Worst of it all, Your Excellency, due to the impaired judgment, these people end up in engaging in unprotected sex. Your Excellency, this ends up in STIs that will end up in hospital. Worst of it all, Your Excellency, this end up with HIV/AIDS. The impact of HIV/AIDS on our healthcare, Your Excellency, is quite high. In 2021-2022, as a country, we spent close to 44 billion shillings on HIV/AIDS commodities. That is money that would have been used for other meaningful things besides being used in healthcare. Therefore, as a ministry, we shall passionately continue to participate in these conversations. And I want to encourage that we have done something, we have a solution. One is that we have developed a mental health policy which has specific interventions to deal with mental health issues and other drug and alcohol abuse issues. Your Excellency, also the National Hospital Insurance Fund caters for mental illnesses and rehabilitation. Therefore, the centers that you have encouraged the governors to be able to put up, they should know that they'll also get support and revenue from National Hospital Insurance Fund as it caters for those who have been affected by drug and alcohol abuse. And lastly, Your Excellency, under your guidance, together with the Excellency, the President, Dr. William Samoei Ruto, as a ministry, and you are working very closely with the county governors, that in the next few days, we are going to roll out over 100,000 community health promoters. These people, we have kitted them. And besides kitting them, we have given them gadgets. One community health promoter will be in charge of 100 households. they have gadgets to collect information about the household. And during the initial engagements, we have added a component on that gadget where they'll be able to collect issues to do with the drug and alcohol abuse. Those statistics will help us as a ministry on how we deal with these matters moving forward, but most importantly, that they'll be able to pick up such cases in the households and be able to direct them to health facilities where such people can get assistance and help. So as a ministry, Your Excellency, we shall continue to participate actively in these discussions. But security apparatus who are here, that
Your Excellency, the Deputy President, or the members from different counties that are here this afternoon, let me be very brief and, with your indulgence, Your Excellency, probably share my experience in this important topic that we are discussing here, being one of the leaders from this region. And I want to really say that I have participated in this debate before, and I remember some time back in the year 2008, and it's on record, I used to have an DCC by the name of Mr. Kipkemei, who rose to the ranks and became the county commissioner one time. I don't know whether he has retired, but he was such a very, very good officer.